would be to have you come in the hospital for a couple of days to start Ticacin, which we could probably give you a higher dose with less side effects. But you have to be in the hospital for 2.5 more days to start that sort of thing. And we don't really know. I always struggle with the same thing in the same procedural situation where you've been partially successful.
I really,
do we put you on some meds now? But then if we do we really know what's causing where you are now? Is it the med or the procedure?
yeah, because you gotta get the time, right?
Yeah.
So now you're acting like
out.
it could take a month
2
or
to
2
3
months
months,
for the
yeah.
heart to heal from what he did in there.
Could be.
Just because
And you're a month out now, right?
Yeah.
So, I wouldn't be opposed to you stopping Sotalol for a couple days and seeing how you feel. It takes 2.5 days. The way medications work, it's 5. Yeah, exactly. It's 5 doses or so, right?
But
take that one
like
pill, we got
2.5 days.
72 hours. I'm just kidding.
Well, would I be okay to, let's say I do that and not go back on Toprol for right now too? Or
my preference would be that you take one or the other. I think long term, especially, I'm sure the Kia and company over there.
I actually liked. It took me a while to adjust to the Toprol.
But
She likes the Toprol.
But I was totally
fine,
functioning, working out, getting through my day, you know what I mean?
I would go back to the Toprol.
Okay.
Yeah, and I think it's fine to just stop one day and pick up the Toprol the next. Do you still have the Toprol prescription?
I probably still have some.
Do you remember how many milligrams it was?
I mean, if I was at home with my little medicine cabinet, I'm sure I still have the bottle.
Let's see, we can look back.
Note here.
Yeah.
Metoprolol 6, 50.
I was gonna say,
50
I
once a
wanted
day.
to say 50.
Yeah, we take it in
So
the
once a
evening
day?
or in the morning.
I take it at night.
Yeah, good, yeah. Yeah, that's how I typically do it for that. The other thing.
I took my 40 milligram xylitol this morning.
Mhm.
I could just not take it tonight and take a Toprol tonight and it's not like gonna mess me up. I did not super loving a xylitol. So whatever, I always want to put it on.
We thought it was killing her one night, and we called in and talked to one of your PAs on the phone, and that was freaky. That's like the other thing too. Is like
That's when they switched my dose.
Yeah, that's when she was really a higher dose.
It dropped my heart
Oh,
rate
the 120.
really bad, and I was like,
well, you're not programmed to pace fast, right?
Yeah.
You're programmed to not pace you, right? So, yeah, that also potentially make you feel. Yeah.
It made her uncomfortable. Like, it was bizarre. That's the other thing I get nervous is I don't know when to freak out or not freak out, because the other day she woke up with chest pain and she started tapping this like 5:30 in the morning, and she's tapping me, and then all of a sudden she's like getting up and like goes down on the floor.
Oh, geez.
Falls out of bed basically, and lays on the floor. So then, but then I know because of previous times when it happens, in like 2 to 5 minutes.
She's okay.
She's gonna be okay, but at the same time, I'm like,
it's freaky.
Seconds and minutes count. So I'm like, if she kills over,
I told him, I'm like, you don't need to panic.
To like due to my negligence, you know.
Shot.
I mean,
so here's the things I look for. So number one, for you, if you're feeling that way, don't get up.
Okay.
Right, because you don't want you falling down again.
Yeah.
Right, just don't.
She tries to get to the floor though, like if
There's something about laying on the hard floor.
She lays down and puts her hands down.
So do you like it? Feels better.
That it like makes
feels
it
better.
and I can get through it better.
Yeah, that may just be time, but fair enough. All I'm saying is don't get up into a standing position.
Okay.
If you're lying down already when it starts. Number one. Number two is, again, she has a defibrillator device. If she really has a cardiac arrest, it will treat her. Okay.
Yeah.
Anything short of that, uncomfortable, not fun, etc., but not likely to be life-threatening.
I've broken lots of ribs. I used to when I was at CPR. I worked with Mark Keep and stuff in the cath lab.
But I always tell him, I'm like, you don't have to do that.
Well, I know, but
she's talking.
But it makes me nervous because I'm like, at what point? As an example, the other night, her mom was with us when she had one. Okay. And her mom's looking at me, and I'm just kind of like, and the kids are like, "Oh, mom's having," and I'm like, "Yeah, mom's having her thing. She'll be okay." My mother-in-law's looking at me like, "What the hell? Why aren't you calling 911 or something?"
Yeah.
You know, and I'm like, "She'll be okay," but at the same time, it's like,
I know it's tough.
There's this balance between me looking like an inconsiderate a-hole husband, or knowing that she's going to be all right.
Yeah, no, it's just because you're actually medically sophisticated enough to understand what's going on. That's okay.
Yeah, I mean,
and she's conscious. It's okay.
Well, I don't want to break no ribs. You know?
No. She'd have to be way unconscious for a full minute or more, and then she would get if that were
Yeah,
significant, you probably would. It's possible you could have arrhythmia still slower than that, I guess. If she was really having her, if she was unconscious and stuff, that's a different story. But basically, there's no such thing as somebody having it terrible enough for them to require that who's conscious.
With
Okay.
the device.
Period. Anybody who's conscious is not having an acutely deadly arrhythmia.
Yeah, and
Okay.
I'm not
Yeah,
start busting her ribs or anything
No,
like that.
I know.
But I sit there and I'm like,
I know.
shit, is this it? Like I'm sitting there, and the thing that's terrifying for me is we don't know, like we're hoping, like, oh yeah, this will knock 10 years or something off the back end of her life is what we're hoping for, or maybe not at all. But like when you see this stuff going on, like, is this it? Is this
no,
and it makes you panic because she's upset, she's terrified, she's like, is it going away this time? Is it not going away this time? So it's just
I know. Well, let's see how this goes.
Not calm.
We can always go back and do more ablation too. I mean, even if you ended up, for instance, it is a choice, for instance, to ablate near that AV node area. If it turns out we end up making you pacemaker dependent, then we upgrade your device to a special biventricular pacing device, which will keep your heart muscle strong and this and that. You know what I mean? So
I think you said
no, I know.
Her machine that you put in there, I think you said is the better one where you could add the lead if you had to, but you didn't add the lead. It just has the one lead, but it's capable of that.
Oh, maybe it is. Yeah.
So,
I can't recall.
So I remember you saying that.
The big reason why I did.
Well, we could add the top wire, but I don't know if we could do the biventricular. But that's neither here nor there for now.
Right.
But that is the point where we could be more and more aggressive. The other thing is the next step we probably do an ablation where we go to the outside of your heart too, right? And because a lot of times sarcoid might be more accessible from there. And again, I do a bunch of it. I actually did that 2 days ago, but it adds percentage points to the risk of the procedure, right? And so I think that all those things, you're so young, the idea here is to kind of chip away at this. You know what I mean? Yeah.
Well, so the big reason why I came back to get the ablation and all that was my ejection fracture
Was dropping.
Yeah. So, and I haven't heard from heart failure clinic since I came here to get my ablation and all that. When do I follow up? Should I call
You
them?
should, yeah. So the deal though is that typically after a procedure like this, it takes a couple of months also before you see the results as far as the ejection fraction and stuff. So I would, so I think in the next, 3 to 6 months is the time to get a repeat echo.
Okay.
Okay.
Normal
so I
is
think
what,
it's fair enough to
65 on a
What's that?
healthy person?
55 to 65 is considered normal.
And I was always at 60.
So athletic folks like us, 65, 70.
Yeah, maybe you, buddy. Mine's like this morning without my coffee, I'm like 13. 14. Did you guys see the Walgreen at 20th East and 94 South?
Yeah.
All right. And so let's discontinue the soda wall, okay? And we'll go back on Torpol and see how you do. Okay?
No,
Yeah,
that's
that
cool.
makes now I'm like I can get up and work out because that was my other question. I was like,
Anything you want to do.
now I've been
Well, were you
nervous
taking
on
the
like,
magnesium
when I
too?
work out versus when I take the Solitol and
Yeah.
Yeah,
You're
I
taking
don't
some
know about
magnesium. The Solitol, we add magnesium all the time because of the potential for worse rhythm issues on Solitol if you get low magnesium. On the other hand, sometimes people do better with more magnesium, period, as far as palpitations and the rest. Are you getting diarrhea from it or anything?
no,
Doing okay?
but I don't like to. I take it every other day.
Okay,
I don't
that's
take
fine.
it every day.
Keep doing that when you're doing that. That's fine. Yeah, I'll leave that on there. I'll leave it on the list for now. Continue it. It's fine. There's nothing magic about it.
Cool.
Unfortunately, there's nothing magic about any of these things. Right?
So
it's just a matter of mixing and matching and sort of feeling our way along. Okay? And, just like we can start stuff, we can stop stuff, we just play around a little bit.
Okay.
And my goal for you is not to have you just be miserable,
Well, I
just for the
feel
sake
like
of taking Sotalol, right?
It's like I was trying to explain it to a friend of mine. I'm like, it's like I get where we figure everything out,
and then everything changes.
but that only lasts, like I might have like a year where we're like, okay, this is working, meds are working good, and then it's like, oh, you know what?
Happens and changes.
Like when I had my PET scan, and they were like, you know what, you have no active sarcoid right now, nothing's inflamed, like,
And
he
ejection
was
fraction was
ecstatic, and I was
lower.
like,
Wait on it.
I'm just gonna wait till I go for my follow-up with heart failure, because this thing's never like,
And that is unfortunately going to be the nature of this. It is a constantly changing deal.
right.
And nobody really understands. I mean, I'm sure you've done some reading about sarcoid.
lots.
If you can tell me what it is, I'd appreciate it.
Yeah.
It's really, right, so
Yeah.
unfortunately it's just something we don't understand terribly well.
The
And
thing
then
that
until, of course,
sucks the most about it is like any autoimmune disease is when I'm having just like a crappy fatigue day or whatever, is people don't get that. Because they're like,
What's wrong with you, dude?
you don't look sick. Like, you worked yesterday. What the hell? Is it that you just don't want to go out with me? Then just say you don't want to go out with me. And I'm like, It's not, you know what I mean?
Yeah.
It's just,
How are your doctors doing for help?
yeah.
I got her a temporary cripple pass from Afshar's office. You know, it's like people give you the stink eye if you park up front at Costco. But then I'm like, yeah, you haven't been there when I've walked in and had her go down on the frickin' floor. So I'm like, screw you guys, you know.
No, I know. It's challenging.
We got old people problems. Her heart and then my
look at you.
my 3 knee
Yeah, but
replacements.
look,
Holy crap.
he's bending at least today.
Yeah, you got 3 knee replacements already.
Mhm.
Football?
Yeah. Football and motocross.
Deep breaths. I don't really have any right now. It's rock solid for the moment. Okay. So I tell you what, let's have her back with me in 3 months. Okay?
Okay.
And let's see how we're doing. Okay? And obviously, if you want
And
to change
then,
something along the way,
as far
let me
as
know.
working out, like,
Back to where you were.
okay,
Yeah,
just,
yeah. Again, you have the life-saving device in your chest. You're a month out from your procedure.
You guys are hella confident in that, huh? 'Cause you guys, every time we talk to you guys about that, you guys are like,
That's the thing.
I'm like, they must trust that a lot
We
because
do. It works.
because
Yeah.
everyone would call them like, well, if you didn't have that, we'd have you come in right now or go to the ER. But since you have that, you're cool. Do whatever the hell you want.
yeah.
So I'm like,
Yeah.
they must love it.
It does
Have
work.
We
confidence
just
in it.
need to probably have more confidence in it.
Yeah.
Well, yeah, dude. I mean, nobody's gonna question your. I mean, you'd be insane not to be anxious about all this stuff,
Yeah.
right? You know. So, but I will say too that if it really is a struggle from that perspective, there's nothing also wrong with getting some counseling about it. You know, if you think anti-anxiety or antidepressant might be helpful or something like
Yeah.
that. You know, this is real life stuff, right? And it's not easy. And so I think that if that aspect of things is making you guys, you know, in a position where you're not sort of living the life you want to live because of those issues too,
Right.
then I would address that. I mean,
We're voting yes in November on the ballot.
good, excellent.
Oh my gosh.
He knows what that means. He's
I do.
probably for it too. Medical use, and then we'll go for recreational like Colorado.
In
Stop.
California and Washington State. And
Yeah, see? You know how
I
much
pay attention.
Yeah.
Alright, so 3 months. Come back.
Anything you
CB in 3 months. Yeah.
not do, caution her for, advise her to do more of,
No.
exercise more, drink water, be
Yeah.
Just
healthy.
be healthy. Just do your thing.
Okay.
As much as possible, try and put this behind.
Yeah. I'd like to.
That's what we want, man.
But
But for
I
the
but I was like this week I just feel like the recovery from the ablation was more than
Well, the Solol probably
I
added
thought.
to that.
Well, and
you know.
the-
I
yeah.
think that's
and then I got a sinus infection
yeah.
on top of adjusting to the Solitol and everything. So it wasn't until like literally this week where I was like, okay,
yeah.
I'm gonna
It's
work
starting to come
out
out
this
from under.
week and I can
Yeah. Let's change
You
your
know.
medicine. Let's see how you do.
okay,
Okay.
Cool, man.
good. I'm
If you,
thrilled.
now, if you start having a big uptick in those episodes, though, then maybe we go back on a little bit of Solol. Or we
Okay.
come in for GPSN or something. You just call us.
Okay.
We wanted you to do the ablation, by the way.
I know.
We were
I've
just,
been
we
in
were
and
just,
out of town.
we were
You
just
know, it's
whoever's
like-
first,
It's
and
like
we're like, we're
It's
not
fine.
playing
Bunch
favorites.
is great. No,
we
no,
don't want you to
believe
feel
me.
butthurt or anything because we had
No,
Bunch
we
do
do
it.
not do that around here. Bunch
No,
is
we're
great.
like-
I had him operate on my mother-in-law.
Yeah,
I love, and you know, I like her.
we're like,
So, yeah, no,
that doesn't mean anything. Man, you gotta work on the mother-in-law.
I know, it could be either way.
If it was your
Trying to
mother,
promise.
then
Yeah, it'd be
just-
different. No, no, Bunch is great, and I got no problem with that at all.
Oh.
Honestly, we don't work that way around here, so.
And we're used to
Okay.
something where it's like whoever can do it the fastest, we'll go with
Yeah,
whoever can
yeah.
do it the quickest.
Yeah. Not all of us do this kind of work, but Bunch and I do. So
Yeah.
That's good. Yeah,
I mean, every time we go down
Well,
to the
hopefully I
heart
don't
failure
have to have
clinic, they
another
have
one
her
for a
seeing a
while.
different person down there.
yeah, they
You know?
really switch around. So,
Yeah.
Yeah.
When
Well,
we
they
see Kia,
always-
it's
they
like a
always tell
four-leaf
you that.
clover.
You're not Dr. Afshar's patient. You're the heart failure patient.
I
And I
know.
was
We
like-
need to start a sarcoid man.
I know.
Well,
that's
I
why
will
I'm
say,
like,
so have you
I
met
always just wanna
have you met
talk to
Michael in
him.
Virginia yet? The new attendings?
I mean, I don't think so.
They're good. They're smart and super nice.
Are they?
Yeah.
Are they down there in that clinic?
Yeah, they joined them now. Yeah, so
Huh.
yeah, Mike McCullough. And
I have had the same
Virginia
PA the
people.
last few times.
They
I've
try and
gone
do
in.
that more often. Yeah.
Huh.
And then you
It's
finish
just nice to
whoever's
see a
there.
familiar face because it's
Nice.
frustrating when someone comes in. They're like, "All right, so
Start
what
from
brings you
scratch.
in?" And I'm
Yeah,
like,
that sucks.
"I don't want to tell you what
Start from
brought me
scratch.
in."
Yeah. Read my chart.
That's right.
Yeah.
Okay, thank you.
Thanks, guys. Appreciate it.
Tanya laughed, but I'm just saying it. But so I have actually been in Jamaica at 420 on April 20th.
You're my man.
I was gonna go, that was planned.
That's